Good evening and welcome to the COVID-19 update on Channels Television. I am Kayode Kikolu. Here are some of the highlights. Conducting safe elections in the COVID-19 context is INEC's goal as it trains its staff and engages stakeholders in Edo and Ondo states. How well are people complying with the guideline on wearing face masks? We found out why this seems to be an issue for some in Bayelsa State. And Hong Kong to offer free tests to all its residents amidst skepticism from local leaders. Thank you for joining us on the program. 992 people have died from COVID-19 in the last 6 months as Nigeria battles one of the world's deadliest, most infectious diseases. Nigeria has now recorded a total of 50,964 cases of COVID-19, with the addition of 476 new cases in the last 24 hours. 37,569 of the total confirmed cases have been discharged, while 12,403 still remain active. A breakdown of the new cases across 17 states and the FCT shows Lagos reported 235, FCT 44 cases, Kaduna 41, Borno 33, Plateau 28, Abia and Edo 13 each, Rivers 12, Imo 11, Oyo 10, Kano 9, Kwara 7, Enugu and Katsina 5 each, Gombe and Ogun 4, while Nasarawa and Zamfara record 1 case each. Meanwhile, the NCDC is asking anyone with symptoms of COVID-19 to call their state hotlines, which is the first line of contact. In a tweet on its official handle, the Commission lists the symptoms to look out for, including loss of taste or smell, difficulty in breathing, diarrhea, amongst others. The Independent National Electoral Commission, INEC, has been on the road consulting with stakeholders and training its staff on how to conduct safe elections in the COVID-19 context. The Commission's team are in Edo and Ondo states where governorship elections are billed to take place in September and October, respectively. Saddled with the constitutional responsibility to conduct elections and the need to ensure that public safety is not compromised, the Commission's National Commissioner, Mr. Festus Okoye, is confident that INEC will conduct safe elections.
Political parties and their candidates must eschew the use of intemperate, inflammatory and base language designed to inflame passions or incite violence. On our own part, we are determined and we are resolved to proceed with the conduct of the Edo and Ondo governorship elections and all the outstanding by-elections. In doing so, the Commission will not compromise the safety and welfare of its staff, ad hoc staff, as well as the voters. We will work closely with the security agencies to arrest and degrade acts of violence. We therefore urge the media to be alive to its responsibility of holding public institutions and individuals accountable for their actions. The media must continue to name and shame those that dwarf the prestige and integrity of our country and bring the electoral process to disrepute.
Well, the COVID-19 pandemic may have raised health awareness amongst Nigerians, but the challenge of access to quality healthcare still persists, with 8 out of 10 Nigerians paying out of their pockets to access healthcare, according to a recent report by World Bank on access to health. The plans are underway to change that narrative as the World Health Organization partners with the Imo State government to launch a mobile health insurance scheme to complement the efforts of the state government in delivering quality health care to the people and help tackle health challenges related to the COVID-19 pandemic. But more survivors of the COVID-19 pandemic have been sharing their experience on how they battled with and conquered COVID-19. Ms. Nanduka Modo, who was recently discharged from an isolation center in Delta State, narrates his ordeal as another reminder of the existence of the virus and the high chances of recovery. Meanwhile, current figures from Delta State show the total number of confirmed cases at 1,646, active cases at 148, discharged cases at 1,452, deaths.
Well, mine actually started sometime in April with a fever, and it was persistent for a while. Took several anti-malaria drugs that never worked. Then, in between, I had difficulty in breathing. Along the same line, I had diarrhea, and it coughed out. It became very persistent. I had to go do the test, and the result came back positive. So I was asked to isolate for 21 days. While the necessary medications were administered, by a team of medical professionals that we had in Delta State.
As at middle of July, nearly about 5,000 tests have been conducted in Delta State, and the figure is still it's still being updated on a daily basis. So if you follow the trajectory, if you follow the trajectory as to the number of tests that is being done as at that time and what we expect today, you realize that the figure is actually increasing. We had that challenge wherein a lot of persons, even some educated persons, who never believed that COVID-19 was real. What we're also doing that is really very critical in the fight is for us to be able to drum up advocacy and sensitization, on the need for the people to adjust their belief system to really accommodate the reality of COVID-19.
Professor Onyiwagbara joins us on the program. Is the head of the Department of Biomedical Sciences, now University of Nigeria, Abuja. He joins us via Skype from Umuahia, Abia State. Thank you for joining us on the program. One exhausting journey for a lot of people, but clearly COVID-19 is not getting tired. Do you get a sense that we're maybe taking our foot of the accelerator just at this moment?
Well, I will not say that in the sense that this pandemic, first of all, Nigerians must understand that we haven't gotten to the peak of this pandemic in Nigeria. But what has happened here where I am now in Abia State, you can hardly see people with their face mask. And why is this so? I think the level of awareness has decreased tremendously all over the country. People are not much caring about this virus. What they're worried about is how they're going to eat, how they're going to feed. But this virus is killing people in the hundreds, globally in the millions. Why are we not doing what we're supposed to do, our own part, to make sure we contain this virus? Not talking about the treatment cocktail that's available. So the government has done their part and continues to do their part, but it's left for the individual citizens of this country to take this virus very seriously. Unfortunately, we are not doing that.
So it appears as though, a lot of people are taking their foot off the accelerator. But, so you talked about treatment, for example, and I know that you have spoken about the development of vaccines and how it's not an overnight thing, rather time and again. But apparently some countries are trying to, prove the world wrong by saying, by next year, we're even planning to give our citizens vaccination. So has that changed your view about getting a treatment for this in the shortest time possible?
Well, when we talk about vaccine is different from treatment of any illness. When we're talking about vaccine, we are talking about preventive measure for anyone that has been exposed to this virus can be able to wear off this virus. But for those, until then, for those that contract the virus, how are we going to treat them? There are 3 phases in clinical trials of any new drugs. The phase 3. Many drugs have been manufactured, tested, phase 1, phase 2, and the phase 3, they end up on the shelf. So if we are going to talk about the treatment of this virus, if we're going to talk about preventing this virus, building immunity that will protect people from this virus, How are we going to do that? When I was on this network a few months back, I told Nigerians and the world that the production of vaccine cannot happen within 6 months. Now, all the countries in the world, all the governments of the world, those in the pharmaceutical industry are doing whatever thing they can to make sure that some of the bureaucracies that are involved in vaccine production are reduced. Now, having said that, there is a possibility that come before the end of second quarter next year, there might be some vaccine or a vaccine in the market, because a lot of companies, a lot of countries are involved in this race against time in order to save humanity. So that might be to the advantage of every global citizen that might be exposed to this virus, that in the next 6 to 9 months, we might be able to see light at the end of the tunnel. But until then, our best bet is to make sure we practice social distancing, put in place all the preventive or precautionary measures that we can be able to put in place in order to reduce and contain this virus.
You know, I understand that Nigeria is participating in a multi-country, trial of drugs, a series of drugs. In fact, I hear that we have about 22 sites from 13 states. And, I wonder, whatever happened to that talk about local solution for this virus? Do you see Nigeria having any comparative advantage, really, in this field?
When we talk about drug product, we have the NIPRI, one of the national agencies that are involved in drug production or drug manufacturing. The enabling environment, the capacity, we are not talking about human intelligence. Nigeria has that in abundance. But the enabling environment that can be able to be put in place in order to harness the potential of us manufacturing vaccine or drug locally that can be able to that we can use to combat this virus and any other illness. I was listening to the former governor of Ogun State, Benga Daniel, on Sunday during Master Samuel Habon's 70th birthday, and he charged Pharmaceutical Society of Nigeria that we should look inward in order to come up with drugs that we can be able, not only the COVID-19, a lot of illness in this country, local content. We have the potential to do that. It's the enabling environment need to be put in place. The mechanism in order to drive the dynamics that can be able to bring the best out of Nigerians to do this has to be put in place. We are not short in knowledge. Nigeria has it in abundance. But enabling environment, science, research is something that involves money. And there's no country in the world that can develop without investing in research and production until we get to that point. But for now, since we are racing against time, I can tell you unequivocally that a lot has to be done in order for us to actualize what we want to do. And that's the honest truth.
Right. I mean, I would also love to see you speak with people around about some of these preventive measures, like wearing their face masks and what have you, especially in your locality where you are. But I'd like to thank you so much, Professor Onyiwagbara, for sharing your thoughts with us on the program this evening.
Thank you for having me, and I apologize for the technical challenges we might have.
It's okay. It's okay, it happens. Well, when we return, Hong Kong is offering free tests to its over 7 million citizens, but some think it's too good to be true. We'll tell you about that when we return. Please stay with us. Welcome back to the COVID-19 update on Channels Television. Let's head over to Bayelsa State, where, like the rest of the world, ensuring that people wear their face masks has been one major challenge. Well, in Bayelsa State, some residents have been speaking about their disposition to the protective measure of wearing a face mask. Our correspondent, Dobra Timiwood, reports.
Social distancing and the regular use of a face mask, especially in a public environment, is one of the rules laid down by the NCDC to stop the spread of the coronavirus. I'm at the Apollo Market in Yenagua, and as you can see, there's absolutely no compliance with the social distancing directive. In fact, nobody, okay, I've seen one person, only this man has been seen wearing a face mask in this market. We spoke with some traders on why they are yet to obey the directive to use the face mask regularly, and here's what they said.
Where I know why I wear them, I get them. If they worry me when I wear them. The mask now, never agree me to talk.
Like for me, if I wear the mask, if it breathe well, they deem me uncomfortable.
Why I don't really like it is not because I don't want to put it on, but because it affects, for me as an individual, it affects my breathing system. Breathing out, breathing in.
As at the last update from the COVID-19 task force in Bayelsa State, there are only 7 active cases for the coronavirus in Bayelsa State out of the 352 confirmed cases. 324 persons have already been discharged, and the state has experienced 21 deaths. From Yenagua, Dobra Timiwood for COVID-19 updates.
Well, Christopher Avong is the Assistant Director, Medical Laboratory Services at the University of Abuja Teaching Hospital. Well, he joins us from our studio in Abuja this evening. Well, thank you for joining us. You know, there was a time during this fight, really, that there was a lot of talk about us not deploying all the resources we have. We're not using our laboratories enough. We're not using manpower as we ought to. And, you know, it went on like that. When you look at where we are right now, do you still see any of those challenges?
Okay, good evening.
Good evening.
Yes, we still have some of those challenges. The challenges of manpower, the challenges of equipment. For instance, now, before the COVID-19, the number of staff that is in a particular institution, that is the strength of staff that was there then, when now the COVID now came in, is the same number of staff that are being used. And mind you, some of these institutions that have isolation centers, some of the staff had to be moved there, like nurses, doctors, and where also laboratory testing is being done, lab scientists also had to be moved to a special laboratory. And so with that, it has reduced the number of staff that were ideally attending to routine patients or normal patients. But now, these staff have been moved to the special care and also the lab, and we are beginning to have the challenges of, not having enough staff that will take care of other patients in the wards, or doctors not being enough to take care of patients. At the same time, even in the special laboratories, there are challenges of not having enough staff that will be able to handle some of the testing. So I think for me, because this is a novel disease, since it has become something that we need to give a special care to, there is also the need for manpower to be improved.
Right. Another issue really is how we can stay ahead of this virus in terms of our testing figures. Yes, there's been a lot of talk about ramping up our tests, but with the ones we currently do at this moment, averaging about 3,000 tests daily, one wonders how true a picture it gives us of where we are. I mean, you see from time to time, for example, the NCDC says, we're adding a backlog to our discharges, for example, or we're adding a backlog, to the number of tests that were done. So how true or how current a picture does that give us, the tests and the figures we see per day?
Yes, actually, the figures you see are quite true. But the challenges we have, like I said earlier, is the issue of equipment. If we can have numerous testing centers, I believe we can even do better than what we are doing today.
Right.
And if we also have enough trained personnel that can handle such special tests, it will also go a long way.
Right.
But because we are having the constraint of equipment, you find out that we hardly can be able to cover the number of people that we're supposed to cover. For instance, now, by the grace of God, I am working with the University of Abuja Teaching Hospital, and I'm also in the testing center of COVID-19. University of Abuja Teaching Hospital happens to be one of the testing centers here in Abuja. Now that we are having a challenge of just having one equipment, we use Gene Expert machine.
Right.
And the Gene Expert machine is just having 4 modules in it. And that 4 modules can only run 4 samples at a time in about 1 hour, thereabout. And you can imagine having a number of patients, because now on an average, we have about 50 to 60 people that comes around. And so if you had to be running 4 samples in an hour plus and continuous like that, how many hours are we going to spend in running some of these tests? And also, if we keep using the same machine day in, day out for a number of hours, sometimes, this machine, we use it for over maybe 12, 14 hours because we stay late. And before you know it again, it's morning and we have to start running it. And hardly does this machine rest. And it keep going like that. So I am of the opinion that if we must have to do a lot better, then there is the need for more equipment to be bought. Like for the Gene Expert, for instance, we have the machine that can be able to, that has 16 modules, that even the modules, there is the one that is even 32 modules. But if we can get the one of 16 modules, you can imagine if you run 16 samples at a time in 1 hour. In 10 hours, you'll be able to run about 160 samples. And so 160 samples in 5 days will be covering about 800 patients. And that will go a long way in us testing people. And I'm happy with what I'm seeing because people are already getting aware. Because
you have raised that fundamental point, and I believe that's a great place to anchor. And we look forward to that, getting better. But we'll have to thank you so much, Mr. Christopher Avong of the University of Abuja Teaching Hospital. Thank you for your time.
Thank you very much.
Well, from September the 1st, Hong Kong plans to offer free coronavirus testing to its 7.4 million residents. Well, although daily cases are falling, a leader, Carrie Lam, described the situation in Hong Kong as critical. But it isn't clear how many might take part in that tests, which are being carried out with help from a team from China.
Doctors in most public hospitals in Kenya's capital, Nairobi, have gone on strike in protest against unpaid wages and a lack of protective equipment.
We do not want to die in our hospitals. Hospitals are run by money, and if this money is being stolen, we will not have hospitals. It is time we stand as Kenyans. It is time we stand as youth. It is time we stand as human rights defenders to defend this country.
Lebanon has begun a 2-week partial lockdown, including a nighttime curfew, following a spike in cases. Infections have doubled since a devastating blast in the capital, Beirut, killed hundreds and injured thousands more on August the 4th, placing massive strain on medical facilities. Hit by a resurgence of coronavirus cases, Hong Kong is to offer free coronavirus testing to all of its 7.4 million residents from the 1st of September. Chief Executive Carrie Lam says the testing will be voluntary and take around 2 weeks to complete.
Well, let's catch up with the amazing content on our website, channelstv.com, where you can get the latest updates on the pandemic. And all you need to do is log on to channelstv.com, all at your fingertips. Well, thank you for watching the program. I am Kayode Kikyolu. You stay safe.